Welcome back to the Symposium. As this one, we have totally 8 speakers and 2 discussions. We will divide this Symposium into 2 sections. The first 4 and this discussion will be in the first section, and we will have 15-minute break after that. And later section, we will have another 4 and 1 discussion. And I would love to put Q&A at the end of our discussion in each half. So we will let the speaker present first, and then we will do discussion and Q&A later on. For the next 4 discussions, we have a lot of well-known speakers who are intensively involved with the tobacco in their country. First, we have the topic of Dr. Chalampon Lamyong, who worked a lot in her tobacco research. Dr. Chalampon, she came from Faculty of Institute of Population and Social Research, Mahidol University, Thailand. She got her bachelor degree of Art Economics from Thammasat University, Master of Art Economics, Chulalongkorn University, and then PhD in Economics from University of Utah, USA. After many years of working in US, she joined the Faculty of Institute for Population and Research, Social Research at Mahidol University, and currently working as the Deputy Director for Planning and Quality Assurance Institute for Population and Social Research, Mahidol University. And today she will sharing with us her project, Intentions to Quit Among Adolescents and Young Adult Smokers from Thailand, finding from the 2012 ITC Thailand survey. The next speaker, we will have Dr. Farisa. She is a medical doctor since 1995, and she served several government hospitals, health center, district health office, and federal headquarters at Ministry of Health, Malaysia. She's been working a lot of tobacco research-related projects in Malaysia. She is currently at Public Health Medicine Specialist and Associate Professor in Health Policy and Management this spring at the Department of Social and Preventive Medicine, Faculty of Medicine, University of Malaysia. Dr. Hair is also a member of several research centers in University of Malaysia, namely Center of Epidemiology and Evidence-Based Practice, Center of Population Health, and Nicotine Addiction Research Collaborating Groups of University of Malaya, Center of Addiction Science. Her current research team basically are prevent elder abuse and neglect initiatives scope, which is basically come from smoking cessation, organizing, planning, and execution. She also do a lot of training healthcare professionals on smoker cessation and public health precision problems. She is also involved in caregiver for elderly research. Small community rehabilitation. She also do a lot of projects related to the tobacco control activity. She devotes her free time to various non-profits and civil activities such as Doctor to You programs and outreach health promotion program for the low-income urban community. And today she will share her topic with us, which is the use of e-cigarette, reason for use and perceptions of harm among Malaysian smokers, finding from 2011 to 2020 ITC Malaysia survey. The third well-known speaker is Dr. Edward Sutanto, who is also a medical doctor from Indonesia. His research basically focused on assessing the public health impact of novel tobacco products, including e-cigarette and heat tobacco products, using population-based survey. Dr. Sutanto get his master's degree of public health from Johns Hopkins University. After the completion of his MPH degree, he completes a 1-year postdoctoral fellowship in Roswell Park Comprehensive Cancer Center, Buffalo, USA. He is currently managing a maternal and neonatal health program implemented in several textile factory in Java Island, Indonesia. He's going to present us use of heat tobacco products among Japanese women, finding from the 2018 ITC Japan survey. And the last but not least for this first section, we have Dr. Jeffrey Fong, a very special guest from Canada, with his topic, Smoker Beliefs about the relative harmfulness of e-cigarette and reason for using e-cigarette. Finding from the ITC survey in 8 Asia-Pacific countries and 14 other countries. As a well-known Dr. Fong, he is a professor and a lot of public health science at the University of Waterloo and senior investigator at the Ontario Institute of Cancer Research. In 2002, Dr. Fong founded the International Tobacco Control Policy Evaluation Project, a consortium of over 150 research across the 29 countries, including 10 Asia-Pacific and South Africa countries. The major objective of this project is to first ever international cohort study of tobacco use, and also to evaluate the policy of the WHO Framework Convention on Tobacco Control. This ITC project has published over 700 research articles and over 100 national and policy reports. Dr. Fong also served as an expert consultant for the WHO and for many countries, including Canada, Australia, Brazil, United States, Singapore. He was expert for Australia and other countries in their successful defense against industry challenge with trade treaty. He has served on many expert groups, including Health Canada, Vaping Product Science Advice Board, and the WHO Expert Group on COVID-19 and tobacco use. Dr. Fong received many awards, including 2011 Knowledge Transaction Award from the Canadian Institute of Health Research, a 2013 WHO World No Tobacco Day Award, 2015 Luther L. Terry Award for Outstanding Research Contribution, 2017 Policy Impact Award from the American Association for Public Opinion Research, 2019 John Slade Award from the Society of Research on Nicotine and Tobacco, 2019 Medal of Honor from the Health Research Foundation. In 2021, Dr. Fong and ITC project received the Canada Governor General Invitation Award. Dr. Fong is an elected Fellow of the Royal Society of Canada, the Canadian Academy of Health Science, Associate for Psychological Science, and Society for Research on Nicotine Tobacco. And we have Dr. Stephen Haman, or Dr. Steve, from TRC Thailand as our discussion. Dr. Steve has worked in tobacco control in Thailand for more than 20 years. And now he is a consultant at the Tobacco Control Research and Knowledge Management Center of TRC Thailand at Mahidol University, Faculty of Medicine, Rama Tibadi Hospital, Bangkok. He has degree in psychology, public health for MPH, and then educational. In Thailand, he worked as assistant dean for medical education in the College of Medicine for 12 years at Langsit University. He headed to the Tobacco Control Policy Research Network from 1995 to 2001. He worked as an international affairs consultant for the Thai Health Promotion Foundation and now for the Thai Health Funded Tobacco Control Research and Knowledge Management Center. He has presented research about Thai tobacco control at more than 25 conferences in the US and other countries worldwide. He also well known for his expertise in the research regarding tobacco control. So we will have Dr. Steve with me as a discussion. So next, please, Dr. Jarampon, with her topic, Intentions to Quit Among Adolescent and Young Adult Smokers from Thailand, finding from the 2012 ITC survey. We have, please.
Good morning, ladies and gentlemen. Today, I would like to share with you on intention to quit among adolescent and young adult smokers from Thailand. We have the findings from the 2012 ITC Thailand survey to discuss on this issue. Beside me, the author of this study comprised of Research Assistant Professor Peterson. Pete is with International Tobacco Control Policy Evaluation Project in the Department of Psychology, University of Waterloo. We have Associate Professor Dr. Ari Champaklai, who is the Director of Institute for Population and Social Research, Mahidol University. We have Dr. Ann Kwan, who is the ITC Managing Director and Senior Research Scientist at the ITC project at the University of Waterloo, and Professor Jeff Fong, who is the Founder and Chief Principal Investigator of the ITC Policy Evaluation Project. I have no conflicts of interest to declare. Professor Jeff Fong has been an expert witness or consultant for government defending their country's policy or regulation in litigation. All other co-authors have no conflicts of interest to declare. Although the risks smoking poses to health are now well known, many young adult people continue to take up the habit. Adolescents who are only experimenting with cigarettes might not consider themselves to be smokers. They may therefore have different intentions to quit smoking than more established smokers. This study examined quit intentions among adolescents from Thailand who smoked in the past 30 days but had not smoked more than 100 cigarettes in their lifetime, which is experimental smokers, versus those who had also smoked in the past 30 days and had smoked more than 100 cigarettes in their lifetime, as we call them established smoker or current smokers. For this study, the data were drawn from Web 6 2012 of the ITC Thailand Youth Survey that were analyzed to examine the characteristics of adolescent smokers. This is a nationally representative sample. A stratified multi-stage sampling design within the regions was adopted to the survey. Two provinces, Chiang Mai and Phrae, were sampling for northern region of Thailand. Nong Thai and Nakhon Ratchasima were sampling for northeastern region. In the Central Plain, we have Bangkok, Samut Sakhon, and Nakhon Pathom. And southern, we have Nakhon Si Thammarat and Songkhla. Data were collected employing self-administered survey. We recruit youth aged 13 to 17. Youth participating in previous survey waves were followed. Some youth from previous wave surveyed at Web 6 were 18 or older. A number of variables relevant to smoking and quitting were included in the analysis. For the measures, there are reasons for smoking, parental awareness, regret about smoking, susceptibility, quit belief, past quit attempts, and intention to quit. 3 variables were used to measure reasons for smoking, comprising of whether curiosity influenced the response to smoke their first cigarette, whether having friends smoke influenced the response to smoke their first cigarette, and whether having friends start smoking this year. 2 variables were used to measure parents' awareness of smoking. First is whether parents know that the respondent smoked, and second one is whether the respondent smoked with parents. We also include the variable on whether the respondents regret ever starting smoking. That was measured as not at all, somewhat, and a lot. Susceptibility to smoking was measured as respondent will probably or definitely smoke in next year versus probably or definitely not, and will smoke the same amount as now and smoke more in 1 year versus smoke less or not at all. There are 3 variables related to quit belief. Quit efficacy was measured by how hard is it to quit, a little, very hard versus not hard. Perceived ease of addiction was measured by how easy to become addicted, a little, very easy to get addicted versus not easy. Past quit attempts was measured by last time to quit smoking in past month, more than 1 month ago, and never tried to quit. Intentions to quit describe response plan about quitting smoking in next 6 months versus longer or no plan to quit. Weighted bivariate analysis examined differences in socio-demographic characteristics of all 965 youth and examined differences in self-report reasons for smoking, regret about starting, and quitting intention by smoking status among 222 youth who smoked in the past month. Weighted logistic regression examines factors associated with intention to quit smoking within the next 6 months with the sample of 222 youth smokers. With the total adolescent sample of 965, 68% were non-smoker. Established smoker or current smoker accounted for 16% of all sample, and 7% of the sample were experimental smokers. Majority of experimental and established smokers were male, 97 and 98%. For established smoker, 14% aged 15 to 17 and 84% were 18 years old or older. 68% lived in the rural area. For experimental smokers, 32% aged 15 to 17 and 65% were 18 years old or older. 61% lived in the rural area. Among 222 youth who reported smoking in the past month, 55% of current smokers reported they start smoking because their friends smoke, compared to 45% of experimental smokers. 56% of current smokers having friends start smoking this year, compared to only 36% of experimental smokers. With the measures of reasons for smoking, curiosity influenced majority of experimental smokers and established or current smokers to smoke the first cigarette. 91% of experimental smokers and 88% of current smokers reported that curiosity influenced them to smoke their first cigarette. Parents' awareness of smoking was smaller among experimental smokers comparing to established or current smokers. 69% of experimental smokers reported that their parents know about their smoking, and 53% of them smoke with their parents. For current smokers, parent awareness was as large as 93.8%, and 79.1% of the current smokers smoke with parents. When we look at the susceptibility to smoke, it showed that 41% of experimental smokers and 52% of established smokers will probably or definitely smoke in next year. 50% of experimental smokers and 44% of established smokers will smoke the same amount as now or smoke more in 1 year, while the majority of smokers regret of ever starting smoking. A greater percentage of current smokers reported having regrets over starting. 86% of established smokers versus 71% of experimental smokers. About quitting, smaller proportion of experimental smokers thought that it was easy to become addicted, and smaller proportion of them thought that it was hard to quit comparing to the current smokers. But greater proportion of experimental smokers plan to quit in the next 6 months comparing to the current smoker. 67% of experimental smokers versus 41% of the current smoker. For past quit attempt, similar proportion, 30% of experimental smokers and 32% of current smokers reported that their last time to quit smoking was more than 1 month ago. However, greater percentage of experimental smokers reported on last time quitting within the past month. 41% of experimental smokers versus 21% of current smokers. Weighted logistic regression reporting odds ratio was used to determine factors associated with intention to quit smoking within the next 6 months. Controlling for other factors, experimental smokers had higher odds of planning to quit within 6 months than current smokers. Adjusted odds ratio equal to 2.92 with a 95% confidence range from 0.86 to 9.88. The demographic factor, gender, age, residential areas, and employment status were also tested for association with intention to quit. Smokers aged 15 to 17 were more likely to quit than those who are 18 years old and older, with the adjusted odds ratio of 3.17. Students and employed adolescents had higher odds of planning to quit within 6 months than those with other employment status. Overall, regret about starting to smoke, recent attempts to quit, and intention to smoke in the next year were significantly associated with intention to quit smoking. regret about starting to smoke were positively related to intention to quit. Adolescent smokers who felt regret about starting to smoke were 7.87 times more likely to intend to quit smoking within the next 6 months. Those who tried to quit in the past month were 9.97 times more likely to intend to quit, and those who will not smoke in the next year were 3.57 times more likely to intend to quit smoking within the next 6 months. In conclusion, in Thailand, more established adolescent smokers who smoked in the past month and smoked more than 100 cigarettes in their lifetimes were significantly less likely to plan to quit in the next 6 months. However, the analysis encountered the limitation on small sample size of only 222 adolescent smokers that would lead to the wide confidence interval. The findings show that the established adolescent smokers were less likely to plan to quit, which suggests that intervention aimed at preventing youth from starting unnecessary to prevent youth from experimenting with cigarettes and transitioning to more established pattern of smoking. Lastly, I would like to acknowledge and thank Dr. Pete Risen for conducting the analysis and the ITC team at the University of Waterloo, Canada, for assisting in the preparation of this presentation. Thank you very much.
Dr. Chalampon. Oh, it's a very interesting topic and very wonderful presentation. I would love to ask one question before we move to the next presenter. What will be your factor that you can, if you, let's say you work with the policy maker and policy authority, what will be your factor to help in order to let the adolescent or teenager to quit smoking in order to influence that intention? We have seen many people who would regret to smoke. We have people to smoke with parents. What will be your conclusion on this? Based on your work of intention to quit among adolescents and so on, right? I mean, what will be your conclude if you want to present this to the policy maker, the factor that we need to help kids in order to prevent them smoke? Or
thank you very much for the question, Dr. Pichitpong. I think from the finding, it suggests that the soonest that we help the adolescent to have the intention to quit would be the best for them, because if we wait for them to smoke for a long time or smoke much in a day, that would be very difficult in order to help them to quit. So the sooner the better. That would be my suggestion.
Yes, thank you very much. That is what we would love to do, if we can prevent them to stop smoking, or we can make them stop smoking earlier. That's better. So please give Dr. Chalampon pause.
Thank you very much.
We will move to the next presentation as Dr. Harry with her topic, the use of e-cigarette listen for use and perception of harms among medicine smokers, finding from the 2011 to 2020 ITC medicine survey. Dr. Harry, please.
Good morning, everyone. I am Fariza Muhammad Hairi, Associate Professor at the Department of Social and Preventive Medicine at the University of Malaya. On behalf of our research team from University of Malaya, University of Science Malaysia, and University of Waterloo, Canada, I will present the findings of the International Tobacco Control Policy Evaluation Project, known as the ITC project in Malaysia from 2011 to 2014 on the use of e-cigarettes, reasons for use, and perceptions of harms among Malaysian cigarette smokers. With respect to disclosures, Dr. Jeffrey Fong, Chief Principal Investigator of the ITC project, has served as an expert witness or consultant for governments defending their country's policies or regulations in litigation. All other co-authors, including myself, have no conflicts of interest to declare. I'd like to start with a short introduction of the ITC Malaysia survey. The ITC Malaysia survey is a prospective longitudinal cohort study of adult smokers aged 18 and older. There were 6 waves of the survey. Wave 1 was conducted in 2005 and Wave 6 was conducted in 2013 to 2014. The survey used a stratified multi-stage sampling design using probability sampling at each stage. In Peninsular Malaysia, the survey was conducted in 5 states: Kedah, Penang, Selangor, Terengganu and Johor. In East Malaysia, the survey was conducted in 2 states of Sabah and Sarawak. In waves 1 to 3, the survey was conducted by face-to-face household interviews, but in waves 4 to 6, because of logistic constraints, the survey was conducted by telephone interviews. At each follow-up wave, the sample of smokers was replenished with newly recruited respondents to replace respondents who could not be recontacted. In this way, the sample size was maintained over time. The Malaysian government is currently in the process of strengthening and expanding policies and regulations of all tobacco and nicotine products. The findings of the ITC Malaysia survey are an important source of evidence for understanding the broad range of specific topics on the use, reasons for use, and perceptions of harmfulness of e-cigarettes among Malaysian smokers. In this study, we examine key aspects of e-cigarette awareness and use, reasons for use, and perceptions of harmfulness among adult Malaysian smokers. In this presentation, we analyze data from the last 2 waves of the ITC Malaysia survey. Wave 5, which was conducted in 2011 to 2012, and Wave 6, which was conducted in 2013 to 2014. The main outcomes for this study were whether Malaysian smokers had ever heard of e-cigarettes, ever tried e-cigarettes, and whether they currently use e-cigarettes. Possible reasons smokers use e-cigarettes were to quit smoking because they are less harmful than combustible cigarettes, to reduce the number of cigarettes they smoke when they were unable to smoke cigarettes, and taste. The final outcome measure was the perceived harm of e-cigarettes compared to combustible cigarettes. Logistic regression was used to estimate the adjusted percentage of smokers reporting each outcome. Percentages were adjusted for sex, age, and cigarette smoking status, defined as daily, non-daily, or former smoker. Multinomial logistic regression was used to estimate the adjusted percentage of smokers who believed that e-cigarettes are more harmful, equally harmful, or less harmful than combustible cigarettes. In general, the sample of smokers participating in waves 5 and 6 of the survey was similar. Very few female smokers participated in either year. More than 70% were under 40 years of age and 80% were daily smokers. This figure presents awareness and use of e-cigarettes among Malaysian smokers in 2011 to 2012, the blue bars, and in 2013 to 2014, the red bars. It presents the changes over time in the percentage of smokers who had heard of e-cigarettes, had ever tried e-cigarettes, and reported currently using e-cigarettes. There was a significant increase in the percentage of smokers who had heard of e-cigarettes from 2011 to 2013. In 2011, 63% of Malaysian smokers knew what e-cigarettes were. This increased to 87% in 2013. among smokers who knew what e-cigarettes were, 32% said they had ever tried an e-cigarette in 2011. This increased to 44% by 2013. In addition, the percentage of smokers who reported they currently use e-cigarettes increased from 22% in 2011 to 32% in 2014. This next slide presents the percent of Malaysian smokers who reported using e-cigarettes not at all, less than weekly, or at least weekly in 2011 to 2012, compared to 2013 to 2014. As can be seen, the vast majority of smokers did not at all use e-cigarettes, but e-cigarette use increased significantly between the two waves. Less than weekly use of e-cigarettes increased from 17.7% in 2011 to 2012 to 23.7% in 2013 to 2014. Smokers who reported using e-cigarettes at least weekly increased from 5.7% to 8.1% by 2013. Both of these increases in e-cigarette use were statistically significant. The ITC Malaysia survey also asked those who use e-cigarettes why they use them. The reasons smokers gave for using e-cigarettes were very similar on many of the reasons in both survey years or waves. Smokers who also used e-cigarettes were more likely to say that they used them to cut down on cigarettes, to use when they couldn't smoke, and to quit smoking. Those percentages were around 50% in both survey waves. However, there was an enormous increase in the percentage of smokers who said that they use e-cigarettes because of the taste. In 2011 to 2012, 17% of smokers who used e-cigarettes at least weekly said they use e-cigarettes because of their taste. This increased to 45% in 2013. We do not know why taste as a reason for using e-cigarettes increased so dramatically. One possible contributing factor may have been an increase in the availability and marketing of flavors. However, the ITC Malaysia surveys did not ask smokers who currently use e-cigarettes about the types of flavors they use. This final slide presents the perceptions of harmfulness of e-cigarettes compared to cigarettes. Among cigarette smokers who knew what e-cigarettes were, there was an enormous increase in the percentage of smokers who believed e-cigarettes were more harmful or equally as harmful as combustible cigarettes. In 2011, 14% of smokers who were aware of e-cigarettes said that e-cigarettes were more harmful than combustible cigarettes. This increased to 34% by 2013. Similarly, the percentage of smokers who said that e-cigarettes were equally as harmful as combustible cigarettes increased from 20% to 36% by 2013. In summary, the ITC Malaysia survey found that awareness, trial and use of e-cigarette increased from 2011 to 2012 to 2013 to 2014 among Malaysian smokers. Smokers using e-cigarettes increased from 22% to 32%, and smokers using e-cigarettes at least once a week increased from 6% to 8%. In both waves, the most common reasons for using e-cigarettes were cutting down on numbers of combustible cigarettes, when unable to smoke due to restrictions, and to quit smoking, with about half of smokers who use e-cigarettes giving each of those reasons. Finally, the percentage of smokers who believed that e-cigarettes are as harmful or more harmful than cigarettes increased substantially from 34% in 2011 to 2012 to 70% in 2013 to 2014. In conclusion, these findings I presented point to the need to continue to track prevalence of e-cigarettes and reasons for use in Malaysia. where awareness and prevalence has been high compared to other countries in the Asia-Pacific region. I, on behalf of all co-authors, would like to take this opportunity to acknowledge and thank the research teams at the National Poison Center, University of Science Malaysia, the Malaysian Ministry of Health, and at the University of Waterloo, Canada, for their dedicated effort in the ITC Malaysia project from 2005 to 2014. Last but not least, on behalf of all co-authors, I would like to also recognize the research support and all the organizations involved in the ITC project. Thank you very much for your attention.
Oh, thank you very much. That is a lot of very useful information that can use for their next survey and also use for the other country. Next, we will have slide from the Dr. Edward Sutanto. And his topic is use of the heat tobacco products among Japanese women, finding from the 2018 ITC Japan survey. Please.
Hi everybody, my name is Edward from Roswell Park Comprehensive Cancer Center in Buffalo, United States. Today I would be walking through some data from the 2018 International Tobacco Control Japan Survey on heated tobacco product use in Japanese women. Here is our disclosure slide. I would like to first start by explaining what is heated tobacco products, which I will refer to as HTPs in this presentation. HTPs are electronic devices that heat tobacco to produce a nicotine-containing aerosol. Although there are different types of HTP as shown in the diagram, some common elements in HTPs include tobacco insert or capsules, heating element or source, and battery. HTP can be differentiated with combustible cigarette, which combusts tobacco at higher temperature, while HTP heat tobacco at lower temperature. This is the main premise why HTPs is being framed by tobacco industry as product that should be considered safer than cigarette. Meanwhile, HTPs can be differentiated with electronic cigarette as HTP utilize actual tobacco while electronic cigarette do not. While HTP has been marketed globally, yet Japan occupies a unique position in global HTP market. Deemed as a fertile testing ground for HTPs, IQOS was first released in Japan back in 2014. There are two major reasons why that's the case. First, Japan has one of the most lenient tobacco control measures in developed countries. For example, it only recently passed a national smoke-free policy in preparation for Olympics 2020. Second, commercial sales of electronic cigarette in Japan is restricted under Pharmaceutical Act. Thus, there is almost no competition from electronic cigarette to HTPs. Japan HTP market, therefore, is the most developed HTP market of all countries worldwide. In 2019, the prevalence of current HTP users in Japan is 11.3%. And compare this prevalence to South Korea, which is the second biggest HTP market, where the current HTP use in 2018 is 4.4%. So there are three major HTP manufacturers in Japan. You can see HTP device brand along with their respective tobacco inserts from the figure. From left to right, you have Plumtech by Japan Tobacco, IQOS by Philip Morris International, and Glow by British American Tobacco. There's also a wide variety of flavor for HTPs. Here are some selected flavor similarity from each of the three major HTP device brands. So you have tobacco, menthol, mentholated fruity, for example, a combination of blueberry and menthol for IQOS purple menthol, and coffee. So I want to delve deeper on why HTPs may appeal to women. First, it is well documented that tobacco companies have targeted women beforehand. Specifically in Japan, though, women have been identified as critical to tobacco market growth, where tobacco companies intend to increase smoking initiation among women through development and marketing of menthol brand. Second, certain characteristics of HTP may particularly be appealing to women. These include advertisement of HTP as being cleaner product and having less smell, along with a wide variety of flavors, specifically menthol and mentholated fruity. Here are examples of HTP advertisement from the 3 major HTP manufacturers, which have women as part of the advertisement, as you can see here. So in this study, our aims are to describe socio-demographic characteristics, product use patterns, along with device brand and flavor preferences among female HTP users in Japan, and contrast this to male Japanese HTP users. Here is the method of our study. The ITC Japan Wave 1 survey is conducted from February to March 2018 with a total number of participants of 4,615 participants. All participants aged 20 and older, which is the legal age to purchase tobacco product in Japan. The survey is weighted to be representative of current smoker, current HTP users, and non-users in Japan. There are 3 groups of measure we included in this study. First, socio-demographic variables, so looking at age, gender, annual household income, and education. Second, current tobacco product use, defined as either combustible cigarette and or HTP use at least monthly. And third, HTP brand device and flavor preference. Here are results of this study. First, I would like to contrast female and male tobacco users in Japan. On the left pie chart, you can see that 5% of male tobacco users in Japan are exclusive HTP users, and 9.4% of male tobacco users in Japan are dual users. In comparison, 4.6% of female tobacco users in Japan are exclusive HTP users, and 6% of female tobacco users in Japan are dual users. Therefore, it appears that HTP is more popular among male than female tobacco users. Let's look at socio-demographic of HTP users. Here is the age breakdown between male and female HTP user. The most common HTP use among male HTP users is on the age of 40 to 59, while the most common HTP use among female HTP users is on the age of 30 to 39. For annual household income and education, more male HTP users belong in high category compared to female. This suggests that female HTP users appear to be younger and less affluent to their male counterparts. A qualitative study in South Korea have reported gender differences on HTP use, especially on motivation and choice of place. Male HTP users use HTP to avoid family members' pressure to quit smoking, while female HTP users use HTP to avoid the stigma associated with female smoking. On the choice of place, male tended to use HTP indoors, mostly in non-smoking area, while female used them outdoors, mainly in streets. We'll move on to the pattern of product use of HTP users. On the frequency of HTP use, similar to male, as you can see here, approximately 2/3 of female HTP users use their product daily. Additionally, with the median consumption of 10 tobacco inserts per day, there are no difference in the number of tobacco-containing inserts per day between both genders. Lastly, on pattern of product use, we'll look at smoking status. Similar to male HTP users, the majority of female HTP users, which is 56.4%, also concurrently smoke. Additionally, only 1.2% and 2.1% of male and female HTP users, respectively, are never smokers. From a public health perspective, this is a positive sign, as the uptake of HTP use among never smokers from both genders appear to be low. On device brand preference among HTP users, we see that IQOS was the most popular brand between male and female HTP users. There are several hypotheses to explain this. First, IQOS was released 2 years earlier than in competitors back in 2014, while PlumeTech and Glow was released in 2016 in Japan. Thus, it has a first mover advantage. Second, IQOS marketing strategy have been noted to emphasize values such as cleanliness and respect for others that are important within the Japanese culture. On flavor preference among HTP users, we see that the majority of female HTP users preferred menthol flavor, and this is compared with male HTP user where the most preferred flavor is tobacco. This finding is in line with previous study among smokers that found menthol flavor was popular among younger and female Japanese smokers. From public health perspective, this is worrying as menthol flavor has been associated with increased initiation, greater nicotine dependence, and higher relapse in cigarettes. Lastly, we conducted multiple logistic regression examining socio-demographic characteristics and product use among female respondents. I want to highlight two findings in this table. First, we found that women with higher education have lower odds for cigarette use. Second, we found that younger and more affluent women have higher odds for HTP use, which are consistent with previous study that reported PMI marketing strategy for IQOS was geared toward young people. In conclusion, there are 4 main takeaways in this study that I want you to take. First, HTP appears to be more popular among male than female tobacco users. Second, female HTP users appear to be younger and less affluent than male HTP users. Third, women strongly preferred menthol HTP flavor. And lastly, age and annual household income are correlates for HTP use among women. Thank you very much for your time and attention. I look forward to answer your question in the live Q&A session.
Oh, thank you very much. What a very interesting one. We have the idea how HTP become popular in Japan and also in Korea based on Dr. Edward Sutanto's presentation. So next, before we have a break, we have a Dr. Jeffrey Fong, a very famous topic, smoker belief about the relative harmfulness of e-cigarette and reason for using e-cigarette, finding from the ITC survey in 8 Asia-Pacific countries and 14 other countries. So Dr. Jeffrey Fong, please.
Hi, I'm Jeff Fong from the University of Waterloo, and on behalf of my many co-authors, I'm really pleased to be able to present our findings on the relative harmfulness of e-cigarettes and reasons for e-cigarettes among smokers, findings from the ITC surveys in 8 Asia-Pacific countries and 16 other countries. I wish I was there in person, but I guess given the pandemic, that will have to wait for another time. Here are my disclosures. And with respect to the ITC project now in 29 countries, it was created in 2002. In our 29 countries, we have conducted extensive cohort surveys in each of these countries. One of our major objectives is to evaluate the impact of FCTC policies. We have 10 Asia-Pacific countries in the ITC project: China, Thailand, Australia, Malaysia, Republic of Korea, New Zealand, Bangladesh, India, Japan, and Bhutan. By way of background, as of course everyone knows, there's been an extraordinary growth of e-cigarettes in a number of countries throughout the world. It is international phenomenon, but there's great variability across countries. Among smokers and former smokers in our ITC countries, we ask a number of questions about e-cigarettes in each of our countries. And we find that those smokers and former smokers who have ever tried e-cigarettes is very low in some countries, in Kenya, Zambia, and Bangladesh, less than 1%, but very high in other countries, US, England, Canada, Japan, where we measure HTPs, or heated tobacco products, not e-cigarettes, Malaysia, and New Zealand. Another important background point is that it's been found in a number of scientific reviews that e-cigarettes are less harmful than regular cigarettes, and this comes from reviews by the US National Academies of Science, Engineering and Medicine, NASM, and also in the UK, the Royal College of Physicians report, and Public Health England. And so what is important, and the focus of our study today, was to examine what smokers think about the relative harmfulness of e-cigarettes compared to regular combustible cigarettes. So there have been a number of studies that have examined perceptions of harmfulness and the relationship to trying e-cigarettes and using e-cigarettes regularly. And one example of this is the US PATH study, which is a nationally representative cohort study of over 40,000 adults and youth in the United States. And there are two papers that have been looking at have looked at the relationship between perceptions of harmfulness and use of e-cigarettes in adults. Tara Elton Marshall led a study that was published last year on adult data who participated in both Wave 1 and Wave 2 of the PATH study, and those waves are about 1 year apart. And this study found that those adults who perceived e-cigarettes to be less harmful than cigarettes at Wave 1 were significantly more likely to use e-cigarettes at Wave 2. So there's a relationship between lower harm perceptions and using that product, namely e-cigarettes in this case. David Strong led a paper also published in 2020 from Wave 1 and Wave 2 data of the PATH study among youth, over 10,000 youth, 12 to 17 years, who participated in both waves. So they found essentially the same kind of result. Those never using youth who perceived e-cigarettes to be less harmful at Wave 1 were significantly more likely to have used e-cigarettes at Wave 2. So both adults and youth it's been shown to have a relationship between perceptions of harmfulness and use of e-cigarettes. So the objectives of our ITC study was to examine the percentage of smokers believing that e-cigarettes are less harmful than cigarettes, the percentage of smokers believing that e-cigarettes are as harmful or more harmful than cigarettes. And we looked at that across 24 countries of the ITC project. We also collected data on the percentage of e-cigarette users who report using e-cigarettes because they believe e-cigarettes to be less harmful than cigarettes. And in Japan, those three measures were perceptions of HTPs, heated tobacco products such as IQOS, instead of electronic cigarettes. There were 8 Asia-Pacific ITC countries in this analysis. You can see them there. And these are all smokers who had heard of e-cigarettes at the time of the survey. And again, in Japan, it was smokers who had heard of HTPs at the time of the survey. There were also 16 other ITC countries outside the Asia-Pacific region, and you can see them there. So the survey question was, compared to smoking cigarettes, how harmful do you think vaping using e-cigarettes is? And those were the choices: much less harmful than smoking cigarettes, somewhat less harmful, equally harmful, somewhat more harmful, and much more harmful, as well as don't know. And this question was either identical across the countries or very similar in the 24 countries of the ITC project. So here's the first slide result, and these are the percentages for each of the countries of smokers who believed that e-cigarettes are less harmful than cigarettes. So let me give you some guideposts for looking at this graph. The first thing is that there are high-income countries in the ITC project, and they're listed in blue. And then there are middle-income countries in this analysis, and also low and middle-income countries. Those are listed in red. Then another important marker is this 50% mark. So remember that the scientific reviews have concluded that e-cigarettes are indeed less harmful than cigarettes. So that 50% mark indicates that in a particular country, that would mean that 50%, half of smokers have an opinion about the harmfulness of e-cigarettes that is consistent with the findings of the scientific reviews. So we also have an overlay of these Asia-Pacific countries, Japan, New Zealand, Australia, and Korea in the high-income countries, among the high-income countries, and then we have 4 other Asia-Pacific countries, low and middle-income countries: China, Malaysia, Thailand, and Bangladesh. Okay, so what do we see here? There are only 2 countries, England at the top and China, the first one of the red section, low and middle-income countries, where the majority of smokers' opinions about the harmfulness or beliefs about the harmfulness of e-cigarettes relative to cigarettes is consistent with the scientific review. So there are no other bars of indicating the percentage of smokers who believe this that is beyond the 50%. All of them are lower than 50%. So then the next finding is these are the smokers in each of the countries, the percentage that believe that e-cigarettes are equally or more harmful than cigarettes. So here you see that there are a number of countries where the majority of smokers and recent quitters think that e-cigarettes are equally or more harmful than regular cigarettes. The top is Poland at the very top, 64%, and followed by Spain, Germany, Greece, and Republic of Korea at 59%. And then the lowest among the high-income countries is Uruguay at 21%. And then the highest among the low and middle-income countries is Zambia at 63%, Romania 61%, Thailand 57%, and then Malaysia 46%, Mexico 40%, Bangladesh at 39%, Brazil 34%, and Kenya and China being the lowest at 15%. But then again, in China, the data that we collected in China last was in 2015, so things may indeed have changed since then. So in this table, I combined the percentage of smokers who believe that e-cigarettes are as harmful or more harmful, and the percentage believing that it is less harmful, e-cigarettes are less harmful than cigarettes, and combined them in a ratio with the same or more harmful divided by the less harmful. So for example, in Korea, 58.6% of smokers believe e-cigarettes to be as harmful or more harmful. Only 23.3% believe them to be less harmful. The ratio is 2.51. So the scientific reviews have concluded that e-cigarettes are less harmful. So a ratio greater than 1 is in the wrong direction. So summarizing the 22 ITC countries in this table here, there are 12 countries for which the percentage believing that e-cigarettes are as harmful or more harmful is significantly greater than the percentage believing that they are less harmful. In other words, the ratio is significantly greater than 1. There are 12 such countries. There were 3 countries that were no different, including Malaysia with a ratio of 1.07. And then in the green territory, there are 7 countries that believe that a greater percentage believe that e-cigarettes were less harmful. And that is consistent with the findings of the scientific review. These include New Zealand, Australia, China, and Japan with respect to HTPs. We also ask vapers why they vape. And among the reasons they can give is because they are less harmful than regular cigarettes. And so this chart here shows the percentage of vapers who use e-cigarettes because they are they believe them to be less harmful than regular cigarettes. You can see from this that a strong majority of vapers in virtually every country, most of them over 50%, are using e-cigarettes because they believe them to be less harmful than regular cigarettes. So it does demonstrate that these harmfulness beliefs are related to reasons for use. Okay, next steps in our research, we are going to examine cross-country differences and try to explain them. And we believe that policy regulatory environment for e-cigarettes is going to be related to these differences across countries in harmfulness perceptions. For example, we believe that in countries that have a strong set of restrictions or perhaps even bans on e-cigarettes, in such countries smokers will tend to believe that e-cigarettes are as harmful or more harmful than cigarettes. In contrast, in those countries that are more or less restrictive on e-cigarettes, that smokers in those countries will be significantly more likely to believe that e-cigarettes are less harmful than cigarettes. We're also going to be examining the relationship between perceptions of harmfulness and product use over time. We've got a cohort study so we can follow people over time to see their transitions in product use. So take the dual users, for example. One might predict that for a dual user that comes to believe that e-cigarettes are significantly less harmful than cigarettes, they will be, over time, more likely to make the transition from dual to being an exclusive vapor, that is, to quit cigarettes. On the other hand, those smokers who are dual users who come to believe that e-cigarettes are as harmful or more harmful than cigarettes will be more likely to give up vaping and go back to only smoking. So we're going to be examining that relationship across different countries to see whether it's there and whether or not it differs across different countries. So, conclusions. The scientific reviews have concluded that e-cigarettes are less harmful than cigarettes, although they are not harmless. But across the 24 ITC countries, smokers' beliefs about the harmfulness of e-cigarettes don't match these conclusions. We know that harmfulness beliefs are known to be related to product use. So these harmfulness beliefs that smokers have significant consequences for product use. Different countries more generally are taking very different approaches to regulating e-cigarettes, including within the Asia-Pacific region. For example, consider Australia, which is taking a very strong restrictive stance on e-cigarettes, versus New Zealand, which sees e-cigarettes and possibly other alternative nicotine products as being part of their plan to become smoke-free. And then Korea versus Japan, where Korea is taking a stronger stance toward e-cigarettes and toward HTPs, whereas Japan is taking a really lax approach toward HTPs. More generally, it is a very important time to evaluate and understand the impact of different regulatory approaches to e-cigarettes and to other nicotine products, notably HTPs and new nicotine pouches. So I want to thank you very much for your attention. This is major support for the ITC project. Thank you very much.
Hello, I'm Steve Hamann. I'm the discussant for the previous presentations, and I'm going to go quickly through the information regarding the presentations and at the end point out a few things that I've noted that might be of importance. First of all, I'd like to say that I wish to dedicate this short discussion period to a psychologist who recently passed away, who made a tremendous contribution to the area of tobacco control and other areas where beliefs and behaviors are important. His name is sorry. His name is Albert Bandura. Anyway, on to the presentations. I'm going to go through some of the initial material about what the presentations did, but the first part is mostly regarding the nature of the study, which I don't think is necessarily that important as compared to the results. So I'm going to probably skip over much of the initial information, but I think you need to realize that some of these studies have been done in the past. Quite some time ago, the study in Thailand was done in 2012, and therefore things may have changed quite a bit. All of these studies done by the ITC program have been done with a rigorous research framework and have been well conducted. I applaud the ITC for having such wonderful survey work done and having such wonderful teams, which I think you noted when they presented the title slide showing many researchers who have worked on these presentations. For example, in the first presentation on adolescents smoking in Thailand, the factors that were associated with the experimental smokers' intention to smoke were 15 to 17-year-olds, students, those employed, and those beginning to regret starting to smoke. Okay, that's for the experimental smokers. For the regular smokers, the intention to quit was associated with regrets to start, tried to quit in the last month, and will not smoke in the next year. Established smokers say that they are less likely to quit in the next 6 months. So, as is usually the case with existing smokers, they say they're going to quit in the long term, but they don't really think they're going to do it in the near term. The limitations of the study was a small sample size, and that there needed to be more information about the possibility of youth interventions within the context of these findings. As I mentioned, this is a study that was done in 2012, and therefore a number of different other considerations are also important that need to be looked at. Going on to the next slide. This is a second presentation about Malaysia. And you can see that the presentation is more current. The second set of findings were in 2014. This has to do with the use of e-cigarettes, and as opposed to the Thailand study, which was smokers generally. So, as can be seen, most of the respondents were young, 18 to 24, male smokers. So this gives a particular slant to the findings. And one of the interesting things is that the awareness and use of e-cigarettes was quite high in the final wave of this study. In the study, there were three greatest reasons for smoking among the e-cigarette users, which were to cut down on smoking, to use when I can't smoke, and to quit smoking. This in contrast to what was presented in Thailand, where the primary reason for smoking cigarettes was curiosity. In other words, somebody is providing reasons to e-cigarette users to justify their use. They're not doing it because they're just curious about e-cigarettes. And in 2014, the results showed that taste increased dramatically as a reason, perhaps because of flavorings being added. So this, in fact, is an indication that the tobacco industry is looking at the situation and trying to come up with more and more reasons and more incentives for smokers to use e-cigarettes. The awareness trial and use of e-cigarettes increased from wave 5 to 6, from 32% to 32% using and 8% using at least weekly. So therefore, a lot more needs to be done to monitor what's going on here with the increase. Even though the harmfulness perception has increased substantially, the use has also increased substantially. And what is going on with that needs to be investigated. Okay, going on to Dr. Sutanto's presentation about female smoking. Heated tobacco products are being marketed aggressively in Japan and in Korea, and this is quite a big problem. The information in 2018 shows that 85% of HTP sales in the region is in Japan. So Philip Morris International started early with IQOS, and therefore they have a stronghold on the market in this region. So we have a situation where we have more male smoking, and the reason for female smoking is to avoid stigma from cigarette use, while males try to avoid pressure to quit. The demographics are quite interesting in terms of why, who is smoking. For example, the percentage of female smokers are younger as compared to the older male population who are using these products. 2/3 of both genders use the product daily. So the preferred device is IQOS, as I mentioned, and there are certain factors that seem to be most important. Overall, the higher use of HTP is by males, and female users are younger and less affluent. women prefer menthol flavors, while males do not, so consequently flavoring seemed to be an appeal for females. Younger age and not low income is related to HTP use, which means that this is probably part of a trend. That is to say that the advertising and the promotion is such that there's a trend for younger people to use the HTP product, younger women. Okay, now for Jeffrey Fong. His presentation is quite comprehensive because the project is in 29 countries, and therefore there's a lot of data being presented because 22 countries are being presented in this research. So assess harmfulness differs by different factors affecting smoker perceptions, and it's very interesting to see what the situation is. He quotes the U.S. PATH study, which shows a relationship between harmfulness belief and the use of e-cigarettes. But when you look at in more detail at the 22 countries, you find that a number of countries, the perception of harmfulness is quite high, and yet there's still an increase in use in e-cigarettes in those countries. So when you look at the relationship of less harm to equally or more harmful, he develops a kind of a ratio or index. And of the 22 countries, 12, including Thailand, consider e-cigarettes more harmful, and 3 countries, including Malaysia, consider e-cigarettes equally as harmful, and 7 countries consider e-cigarettes less harmful, such as England, which has bought into using e-cigarettes for smoking cessation. So why these country differences? He talks about the information environment as being different, and the policy and regulatory environment being different. Scientific findings do not match smokers' beliefs of harmfulness, and harm perception related to product use regulatory differences are also important. So the implications is that now is an important time to evaluate these regulatory approaches to new products like e-cigarettes. The implication is also that scientific findings are oftentimes not the most predictive of what's going on, which is to say people use products mostly because of consumer trends and so on, and don't necessarily even look at the scientific findings in regards to toxicology or epidemiology of a certain product. So a few last items. Thailand needs more continuous and updating of cigarette and e-cigarette monitoring because the study cited is only 2012, and this is quite important for Thailand. Malaysians seem to have many reasons to want to use e-cigarettes, including their flavorings, but there's a perception of great harm from e-cigarettes, so resolving this contradiction is kind of important to understand. Japanese women are the industry's big opportunity, and HTP products seem to be well positioned to gain more women users, unless more is done to inform women of how HTPs are exploitive. Comparatively, from Jeff Fong, countries are confused about the overall harmfulness of e-cigarettes, and this is driven by the information environment and regulatory frameworks in countries worldwide. Despite research that can clarify some of this confusion, the battles in the media and in the research community may persist. Those are my brief comments, and I thank you for listening to my overview and discussion.
Well, thank you very much, Dr. Jeff. Dr. Steve, that is very good conclusion for each paperwork, and I believe that most of us also want to see the result for the future work for each paper. I also have few questions from the audience and also myself to ask for the presenting for each one. Let's start from Dr. Chirampon. There are a question specifically asked, what will be your recommendation for the school if they want to prevent students from smoking and also in order to help students to quit smoking? I asked you the question before we move to the next presentation, right? And you say that the best way is try to stop them or prevent them sooner the better. So what will be your recommendation for school?
You're asking me?
Dr. Chirampon.
No, okay.
You have to turn on the mic first.
Thank you very much. Thank you very much, Dr. Pichitpong, for the question. Thank you very much for the floor, for the very good questions. The recommendation for school, I think the recommendation that I can give right now is just to try to create the safety environment in school. That one is very important because we find that friends is an important factor that influence adolescents to smoke. On the other hand, good friends could be great preventive factor as well. So I think 100% smoke-free school is important to prevent adolescent smoking and can persuade young smokers to quit as well. So if we strictly have the 100% school, smoke-free school, that will create the perception for the young adult that smoking is not okay, smoking is not cool, or any signals of perception against smoking in school will be helpful, like it is not the cool symbol, or it is not a cool thing, friends do not smoke. Moreover, the protective surveillance system with the collaboration between school and parents would be helpful to help young adults to quit as well, because we find that just only some parents know about adolescent smoking when they are in the stage of experimental smokers. So this is a very good stage to that they're gonna have a large proportion of intention to quit. But if small proportion of parents know about this, that means that the parents will not be the supporter to help them to quit. So if the school can collaborate with parents, I think parents will be the part that can help to the young adult to quit as well. Thank you very much.
Thank you. And one more question. According to this, Dr. Chirampon, based on your research, you found that many kids, they also smoke with their parents. So what should us do as the policy advocacy or the health worker in order to avoid this problem? Because if they say that, hey, I smoke with my parents, it's not that bad, then why my parents smoke? So what should you suggest for the school?
Thank you very much. This is a very important question, and it's the thing that we as adults, we should really concern, because there are such a perception that spread in the society that smoking is okay and smoking is okay for the young adult as well. Even their parents feel okay for them to smoke. So I think we need to elaborate this perception. Nothing we can do much except just to campaign to let everyone know that smoking is not okay, especially when they start young. It's not so good for their health at all. The parents is the one that need to input the good information to them instead of not just performing like it is okay for them. So we need to change the perception of the society, as well as in school, as well as the peers in school, in the family. Everywhere need to know that this is not okay for the young adult to smoke.
Okay, thank you very much. So next question for Dr. Hardy. Based on your research, you've find out that, like Dr. Steve said, there are some contradict between the data, like the people, they also aware of the harmfulness of the tobacco increase, right, Steve? But somehow they still use e-cigarette and also use other product more in Malaysia smoker. So what do you think about this, Dr. Hardy?
Okay, yeah, thank you very much for the question. So I guess we need to make sure that people understand what harm really means. I think for them, perhaps it will be harmful to others, but if they are the ones using the e-cigarette, it is not harmful to themselves. So perhaps the understanding of harmfulness needs to be highlighted and also be given more attention, and to get more people to really understand what harmful means when they take up e-cigarettes.
Okay, thank you. And next for Dr. Sutanto, we have the heat tobacco product among Japanese women, and you say that they are divided into the social standing and also the age, and you say that the result is quite different compared to male and also different compared to Korea. So what do you think about this? Why I mean there's difference, and why they still use the heat tobacco? Because based on the Professor Fong, they also say that Japanese is one of the countries that believe the harmfulness of e-cigarette is more than the normal cigarette.
I'm sorry. Could you repeat the question again? I think my internet was disconnected, so I don't think I get the first part of the question.
The first part is why it's quite different, I mean, in the Japanese female or woman compared to the other country like Korea. I mean, the society, I mean, the age and also social status, and why it's increasing compared to what, based on Dr. Fong say that Japanese is one of the countries that aware of the harmfulness of e-cigarette. So why do you think it's like that?
Yeah, so one of the reasons why is that the regulatory environment in Japan, the e-cigarette is regulated as a pharmaceutical product, and therefore their purchases, there's no commercial purchases of the e-cigarette itself. Thus, in general, while e-cigarette is more tightly regulated, the HCP are much more widespread, and therefore this is the reason why the HCP is also majorly promoted by tobacco industries, and thus the perceptions is for heated tobacco products is obviously much more is less harmful than cigarettes, because there's a huge advertisement over it too.
Okay, thank you very much. And the last one for you, Dr. Fong. We have a lot of questions from the audience, but I will just pick few of them, because if I ask you all the questions, we will out of time. So what do you think about this COVID-19 situation? It will lower the consumer of the e-cigarette or normal cigarette?
Well, let's see. In my keynote yesterday, I presented some results of the COVID pandemic in the 4 countries, Canada, US, England, and Australia, showing that there was no net increase or decrease in smoking. And I mentioned at that time that that may have been a relatively good result for public health, given that a lot of natural disasters or man-made disasters, 9/11 for example, led to greater smoking. So the fact that during the COVID pandemic, at least the initial part of it, there was no net change in it, probably represents a relative good result. We've also done those analyses that we haven't published yet on the effect on vaping, and it's about the same. There was no real net change in vaping due to the COVID pandemic. So our work will go on. We're going to be continuing to collect data, and the fact that COVID is approaching in many countries an endemic disease and threat we're going to be doing work on the impact of COVID on many things, not just tobacco and nicotine product use for many years to come.
Okay, thank you for that. Then the next question for you, Dr. Fong. I mean, based on the presentation, is the inclusion of Japan, the HTP, the heat product, are appropriated? Because unlike the EC, many major reviews, they haven't concluded that HTP are basically less harmful than the normal cigarette.
Yeah, my inclusion of Japan wasn't meant to say that HTPs were equal to e-cigarettes in potential relative harm compared to cigarettes. Indeed, a number of studies have suggested that HTPs are closer to that of cigarettes. Some findings suggest that in a number of key measures like bronchioepithelial cell cytotoxicity, HTPs are lower than cigarettes, but a lot higher than e-cigarettes. So they seem to be in the middle someplace, and some people have suggested that they might be closer to cigarettes than to e-cigarettes. But the debate will go on with respect to that. The reason why I just listed that was because I didn't know where else to put it. I wasn't going to have a single slide with just Japan. So that's why I called out Japan, indicating that had to do with HTPs, without making any judgments one way or another, just to compare what's going on in Japan with HTPs compared to the other countries with e-cigarettes. So it wasn't any kind of editorial comment. It was just, I've got all these countries with ECs, Japan, that's interesting.
Oh, okay, thank you very much. They have one quick question. It's always come in my mind too, based on my experience with the e-cigarette. Many of my students, because I'm basically background in engineering and technician, they smoke a lot of cigarette and also e-cigarette. Somehow, those of my students, they do DIY, do it yourself. They modify the e-cigarette, adding flavor and adding some other things in the market product. And I don't know how much it will change the harmfulness of e-cigarette compared to the normal one. I mean, this is what always in my mind, and I would love.
Well, right. Well, with any kind of product, it's not just e-cigarettes, but any consumer product you can think of. If there is some potential harm for that product, and there isn't good regulation of that product, you're going to get all kinds of potential problems with it. And so each country has to decide what they want to do about vaping products and HTPs. And some have taken a very strong stance against them, and some have taken a more lenient stance toward them. But whatever you do, regulation is really important to the extent that people are actually going to be using them, even if they're banned. So in Australia, there are a lot of vapors in Australia, despite the fact that it's only used in a pharmaceutical, context, a medical cessation context. But there are a lot of vapors there. So it's kind of hard to regulate something that is completely banned because there's no context for that regulation. So I'm not prescribing what countries should be doing with respect to e-cigarettes in and of themselves, but that we hope that the scientific evidence is going to be helpful in providing countries with the way forward as far as regulating these products, because throughout the world, a lot of them are here to stay, at least in the short term and the medium term. And given the fact that the tobacco industry, PMI, JTI, BAT, have invested in heated tobacco products, there's going to have to be strong consideration about how to regulate these things.
Okay, thank you very much. Dr. Steve, do you have any other thing to add in this symposium?
I think we're just about out of time. I think we've gone through most of the things that we've needed to discuss. I'd like to just thank all of the presenters for doing such a fine job. I always am impressed by ITC presentations, and I thank everyone for their work.
Okay, thank you very much.
Thank you.
And before I closing the first half, before we have a 15-minute break, I would love to say thank you very much for all of the speaker and audience. And I would love to say thank you very much for Professor Lakshata Shashtanawin, who was a former Ministry of Public Health, in order to make this Tobacco Act come true in Thailand. He worked a lot with our team and also many people in order to push this through. As you know, that it's very difficult to make the Tobacco Control Act in Thailand. We have many other people who try to make a break light out from gathering the farmer who make the tobacco product. So I would love to sincerely thank to Dr. Rashtanawin. And thank you very much. So we have 15-minute breaks.
Well,
Yes.
I just have one more very brief thing to say. I want to thank Steve for honoring Albert Bandura, a social psychologist at Stanford. I knew him as an undergraduate, and I knew him throughout the years. We gave him an honorary degree at the University of Waterloo a number of years ago. He was truly an inspiring pioneer in the field. So I want to thank Steve for honoring Dr. Bandura.
Okay, thank you very much, everyone. It's an honor to be here, and we have 15-minute break.
Thank you.
Thank you.